So last part of this lecture is we'll be tackling briefly on acquired diseases. Before I proceed, I'd like to give a shameless plug. So I recently started an Instagram account to showcase different cases that I see from day to day and relate it with some of my hobbies. So hopefully you'll follow. That's the Instagram name at Justin Radiology. So let's proceed. So one important application of CT scan in cardiovascular imaging is the calcium scoring system. So it's it's used to assess plaque burden in patients. Basically, you map out parts of the heart that has calcifications, and it has a corresponding Agatson score, and you add the total score, and you'll be you'll be able to come up with a plaque burden. Now, this plaque burden has a significance in identifying coronary artery disease, and the risk there's risk assessment involved, and you can also recommend the next step for the patient. That's why it's important. So we are this is already available in our setting. Next, for cardiomyopathies, there are different types of cardiomyopathies. On plain radiograph, we have a few signs that we can see, like if it's a dilated type of cardiomyopathy, you'd expect to see a prominent left ventricular chamber. So some of this, you have to look at the 2D echo of the patient as well as the cardiac CT or MR to assess the ventricular wall thickness, the cavity, and the contractility and compliance of the heart. So for cardiac masses, the most common cardiac mass is still the thrombus, and this is one example of a thrombus in your left atrium. So these are four chamber views of the heart on 2D echo and on MRI. So these are your four chambers. So this is your thrombus, which is located at the left atrium. So the differentials for these masses would be, um, if we're looking at benign masses, we have the most commonly is the myxoma, and myxoma commonly occurs in the left atrium. That's the most common. For the thrombus, it's usually seen either in the LA or LV. So that's the usual location. For those are for benign, so most common benign is your myxoma. For most common malignant cardiac mass, it would still be metastasis. Although it's still more common to have pericardial mets in the form of malignant pericardial effusion than actual cardiac metastatic lesions such as these. Then for um, the most common malignant primary um, cardiac mass, that would be angiosarcoma. So those are the four things that you should remember. To recap, most common cardiac mass overall is still a thrombus. Most common benign primary cardiac mass would be your myxoma. Most common malignant mass in the heart would be metastasis. The most common primary would be angiosarcoma. So those are the things I want you to remember. Now, this is an example of radiographic finding that um, it's not a common disease, but when we see the finding, we know that it's the disease itself. So it's not a common finding, but the radiographic features are pathognomonic of this disease entity. So these are what we call the Antmini signs. So in this case, we have um, calcifications that is silhouetting the margins of the heart. So by that, we know that it's localized to the pericardium. So it's pericardial uh, calcifications. And this is typical of constrictive pericarditis. So you have a normal shape, normal sized heart, and calcifications all over. So not a very common disease entity, but again, the imaging finding is typical. So this is actually where radiologists play a very important role because we are able to detect such disease entities which are not common in in clinical practice, but when we see it, we know what it is. Then another process that's important is your pericardial cyst. So this is an example. So when identifying masses in the chest, we have to first localize if it's originating from the lung parenchyma or from the mediastinum. In this case, we know that it's arising from the mediastinal contour because the angle is outward. And on CT scan, that's proven because it's pushing the lung parenchyma. So this white curvilinear band you see here, that's due to atelectasis. And that's because this cystic structure is pushing it peripherally. So this is the pericardial cyst. It's continuous with the right side of the pericardium. You can see the continuity. So in attenuation, this is low fluid attenuation, and this is how cyst appears on CT scan. So that's it. Um, I didn't really go much into the more complicated topics. What's important is that you master the basic ones. Um, you have these lecturers that give you those simple topics, and then when the exam comes, all the questions are much more difficult, and it's never in the lecture. So that's me on her, not really. That's not me. So again, from the start, I want you to focus on what is important and what is commonly seen. And these are the typical things that you will see in practice, even if you're not a radiologist. So, what's important is that we are able to communicate. Um, there is correlation between the clinical and the radiographic findings. And if we are able to maximize the imaging modalities and the history and PE of the patient, we'll be able to manage the patient properly and optimally. So that's very important. And that's always the thing that I want to impart to the students because more or less, maybe in your class, maybe less than um, less than 5% will go into radiology, maybe only one or two. So it's important for the rest of those who will not go into the field that you have a working knowledge of the field and um, what its importance is to your practice and how you can maximize it. So that's what I want you to have also. So come up with the learning issues that you think will help you in practice in the future. Don't come up with um, learning issues that will just complicate your life. What we want is we simplify the approach. Um, we make it fun and you enjoy learning. So thank you once again and good evening.